Very good. Well, good evening, everyone, and thank you for joining us. My name is Dr. Chirag, and we have an exciting presentation planned for this evening. So my goal is to make this informative for everyone, and we do have some time kind of reserved at the end for any questions or answers that come up. So again, my name is Dr. Chirag. I'm a urologist here in the Metro Atlanta area. So my background is I'm a native of the Smyrna, Georgia area and practice currently out of the Marietta office, and also see patients in Canton and Jasper, Georgia as well, but really treat patients throughout the Metro Atlanta area. I trained as a urologist in Michigan, and then did a fellowship at Johns Hopkins in men's health with a primary focus on erectile dysfunction and prosthetic surgery. And so this is an area that's kind of near and dear to my heart and something that I'm most focused on in my practice. Excited to be able to be back in my community and helping, folks in neighborhoods that I grew up around. So it's a topic I'm excited to speak about this evening. So again, this presentation this evening is by our partners, Coloplast. They are really leaders in men's health and intimate issues. They've been great partners of mine over the years, and are always great about providing these educational opportunities for my patients. So certainly appreciate Coloplast partnership with this. So the goals of our presentation this evening, first and foremost, is to understand erectile dysfunction, various causes for erectile dysfunction and the type of psychological impact that can have to patients and families. But probably what most of you are interested in are various treatment options for erectile dysfunction, and we'll look at various patient perspectives and other resources that are available. So ED can certainly be hard for patients to deal with. It not only impacts intimate moments, but lots of research has shown that this can impact a man's daily life and his overall confidence. So certainly I applaud you for being on this presentation this evening and really taking the first steps in taking back control of your intimate moments. So you're certainly not alone. ED is very common. Most of you hear and see advertisements on radio and TV, and I think that speaks to just how common of a condition this is. ED affects approximately 50 million men in the United States, and about 40% of men by the age of 40. The good news is that ED, although it's very common, in most cases it can be treated. And we're going to talk about that this evening. So ED also has many psychological effects. 50% of patients say it negatively impacts their daily life. It can lower their confidence. 84% of men spoke on that. 50% of men states that it impacts their relationships with their significant other. And then 69% of patients say that ED negatively impacts their ability to have intimacy. So this can lead patients feeling disappointed, frustrated and angry, ashamed and embarrassed, or inferior and insecure. And, I think that's what I enjoy about my job, is restoring that confidence for patients. So what is ED? Simply put, it is the consistent inability to sustain an erection that's sufficient for sexual intercourse. And so I think the important thing is that ED, while it's a general term, it can mean different things for different patients and different couples. For some patient, it's not being able to get an erection at all. For some patients, it's kind of inconsistency with their erections. Some patients say that they can't sustain an erection hard enough for penetration during intercourse. So when I'm meeting with patients, I think it's important to, go into this history and kind of understand what the patient's, frustrations and objectives are. So, a lot of patients will tell me, well, hey, I'm having difficulty, but it's, because of my age or because I'm getting older. Well, it's important for patients to understand that, there's many different causes for erectile dysfunction. And though frequently, those causes are more prevalent with older age groups, it can almost always be traced back to an underlying issue that we could potentially treat. So diseases such as diabetes, high blood pressure, cardiovascular disease can certainly impact erections. Many of my patients have had prior surgeries such as prostate removal for cancer, potentially other pelvic surgeries like colon cancer surgery or radiation, various medications, particularly, high blood pressure medicines, antidepressant medications come to mind, but even recreational drugs, tobacco, drugs, alcohol, can impact erections. And then some patients have had spinal cord injuries, pelvic fractures, different injuries, particularly in the pelvic area, can cause issues here. And like I said, about 80% of the time, it can be traced back to some kind of physical problem or disorder. So, before we go into various treatment options, I think it's important to understand how exactly an erection occurs. And this is something I try to go through with my patients when they come to the office. So it's a fairly complex physiologic process that occurs in the body, but generally some kind of sexual stimulation or excitement, causes the brain to release neurotransmitters. These affect the nerves, heart, and blood vessels, and starts triggering a blood flow event towards the penis. And so as blood starts flowing into the penis, and this is typically due to nitric oxide release from the nerves at the bottom of the spinal cord, arterial blood flow that's carrying oxygen comes into the penis, causing what we call the corpora cavernosa, or the cavernosal arteries, to engorge and cause expansion of the penis. Well, surrounding this arterial layer is a thick connective tissue called the tunica albuginea. Just outside of that are the veins, depicted here in blue, that carries that deoxygenated blood back to the lungs. So when this area is maximally engorged, it should also be compressing these veins so that all the blood is trapped within the penis during the erection. And so the reason I go through this kind of start to finish with my patients is, a problem literally anywhere in this process, whether that's, hormones circulating in the blood, brain, spinal cord, and nerve function, blood flow into the penis, or even soft tissue disorders within the penis itself, they can all manifest to the patient as erectile dysfunction. It's sort of my job to figure out, hey, where is the problem and what do we need to do to fix it? And in almost all cases, it's multifactorial. So, very rarely is it just one issue that's causing the problem. We usually have to target this pathway in multiple areas to get a good outcome. So no matter what the cause of ED is, there's definitely hope. And I'm encouraged by that, just given the success rate with some of the treatment options. So, a general overview, we have oral medications, penile injections, vacuum erection devices, certain medicines that can be inserted into the urethra, and then surgical options such as penile implants, and we'll go through these. So the first category is oral medications. Almost all men are going to be at least initially offered or tried on this. These do, kind of work as an initial treatment option, but approximately 40% of men will say that they're not effective, or over time, men feel that these medicines become less effective. And so most of those men are discontinuing these medications, either due to the medicine becoming less effective, concerns about cost of the medication, and many patients will experience side effects or have, reasons why they can't be on these medications. So the most common medications are Viagra and Cialis. Generic names for those are sildenafil and tadalafil, but Levitra and Stender are other options on the market. These are all classified as PDE5 inhibitors, and they're really working to stimulate nitric oxide release from the nerves at the bottom part of the spinal cord. So they may help patients achieve erections, but they don't tend to work as quickly as a penile injection. And as we discussed, they can have side effects, such as headaches, facial flushing, upset stomach, back pain and muscle aches, or nasal congestion. So again, it's something that we'll often try first with patients, but as you can see here, there's a decent amount of patients who either can't tolerate or don't want to be on these medications. It also has issues with spontaneity, in that a lot of patients have to kind of time intercourse by taking this medication in advance of, when they plan to have sexual activity. So there's a little bit of planning that is involved here as well. So the next category is penile injections. So when patients fail an oral medication, a lot of times they will opt to move on to penile injections. So these are vasoactive medicines that patients inject directly into the penis themselves. And so the kind of feared complication of this medication is a condition called priapism, which is a painful erection that's lasting longer than 4 hours. And that's an emergency, needs to be addressed immediately, either in the office or the emergency room. And so that's really kind of the feared complication of this medication. And, the reason it needs to be administered safely and monitored, but it's certainly an option for our patients. So the advantage of penile injections is that they work relatively quickly. So, it helps with the spontaneity aspect, but, understandably, this can cause some pain at the injection site, bruising, especially if patients are on blood thinners, over a long period of time. It can cause scar tissue and deformity of the penis. And, again, we worry about priapism or prolonged erection. And it does require a fair amount of manual dexterity and training of the patient before we can kind of trust, this being done at home. The next category are vacuum erection devices. These have been on the market for a long time. I believe you can even get them now without a prescription on Amazon, with instructions, and pretty decent devices. And so this can be used either individually or in combination with other treatments. So, the advantage is, again, it's drug-free, relatively cost-effective. Again, don't even need a doctor's prescription usually to get these devices. The main issue is, it doesn't give as natural kind of looking and feeling of an erection. It's kind of inconsistent for patients, and, without proper instruction or with certain anatomy, it can cause discomfort, numbness, bruising, swelling, various issues for patients, but, generally no harm in patients trying this if they're motivated. Insertable medications, are somewhat difficult to find nowadays at pharmacies, but, certainly it is an option for patients. But this is very similar to the penile injections in terms of the type of medication, but rather than injecting it into the penis, it's being placed in the urethra, and that medicine can help, spur on an erection. So, advantages are, really that you're not having to inject yourself. It does tend to, work pretty quickly and probably has a lower risk of priapism than a penile injection, but it can cause some burning, pain with urination, and even pain to the partner when using these medications. So, that's a potential side effect of the medication, and certainly something that patients can consider. And then the last category here is penile implants. So these are surgical options to cure erectile dysfunction. So what I tell patients is everything we've discussed prior is kind of trying to help blood flow, help, augment therapy and improve symptoms, whereas a penile implant, is really a curative category. So it's intended to restore that patient's spontaneity, and has several advantages that we'll discuss here. So penile implants, like I said, is a long-term ED solution. 75% of these implants last 10 years or more. So there's, these implants, I believe, have been on the market for over 50 years. So there's lots and lots of clinical data that's been published on these, and excellent long-term durability. So that's something that I frequently discuss with patients. As I mentioned, spontaneity, I think that's probably one of the biggest advantages to patients, especially if they've tried and failed, oral medications and injections. I think what they appreciate the most is just getting that spontaneity back, being able to travel, feeling confident that they can perform whenever they want. The inflatable penile implant, particularly the Titan implant, is the most natural looking and feeling implant. So it's able to become maximally inflated during erection, but you can also deflate the implant so it can easily be concealed. And so that's an advantage over, different devices on the market. And the engineering is outstanding on these devices. So, through a pumping mechanism that we place in the scrotum, this gives patients kind of complete control over how they're going to use this, and we'll review that. So I'm going to show a brief video here, of exactly how the implant functions, so we can take a look at that. Components of the reservoir, the cylinders we place in the venous, and the pump that we place within the stroke. So you see here the patient is pumping the implant, which is transferring fluid from the reservoir into the cylinders to achieve the erection. After intercourse, there's a deflate tab. The patient squeezes tabs, he can gently transfer fluid back into the reservoir. So with penile implants, satisfaction rates are extremely high, possibly the highest satisfaction rates of any, surgical procedures in medicine. Patients reported 98% satisfaction with a penile implant for erectile dysfunction, and partners reported 96% satisfaction. So, patients tend to be very, very happy after this procedure. And again, very helpful at kind of restoring that spontaneity, that confidence for patients. So why the Titan penile implant in particular? It really comes down to the engineering, right? So this implant has been around for a long time. I think amongst high volume implanters in the country, it's the most commonly used penile implant. The BioFlex material is 3 times more rigid than the competitor implant. It also has the most girth of any implant on the market, approximately 17% more girth than the competitor implant, and 3 times more durable than the competitor implant. So those are some of the main advantages of this particular implant, the Titan. So another option for patients is what's called a malleable penile implant. So these are semi-rigid or non-inflatable penile implants that can be placed. These implants are always in the rigid position. They can be flexed up or flexed down, but it doesn't have the inflating mechanism. So it tends to be easier sometimes for patients to use, particularly if they have, limited dexterity or use of their hands, potentially if they've had complicated past surgical history, especially in foreign countries, where cost is more of a concern. This tends to be a less expensive implant than an inflatable penile implant. I think the major disadvantage is maybe it's not as natural looking and feeling, as the Titan implant. And sometimes it's hard to conceal this implant because it remains firm even when it's not in the erect position. So everything we do in medicine has potential risks, and I think it is important to discuss that. So I think, if you're considering this procedure, a thorough discussion with your physician is important. So anytime we cut the skin, there's a risk of infection or bleeding. We do lots of measures to reduce the risk of infection. This is a mechanical device, so there is a low percentage, but albeit real risk of some device malfunction. And so these are just various things that you'd want to discuss and review with your physician if you're considering this procedure. Insurance coverage is generally excellent for penile implants. It is a recommended treatment in the American Urologic Association guidelines, and it's covered by most major insurance companies, including Medicare. Coloplast has a number of resources to help patients, in the event of an insurance denial, and certainly, our practice, is happy to liaison and kind of help in any kind of denial situations. So this was an interesting study. They looked at the average cost, that patients were experiencing with various treatment options. And so with sildenafil or generic Viagra, the average annual cost was about $768. With penile injections, because they're not typically covered by insurance and they come from compounding pharmacies, cost was around $8,000. Whereas the average total cost for a Medicare patient undergoing a penile implant was $4,402. But again, a one-time cost, as these are very durable treatment options, and you'd expect that to last for a number of years. So in conclusion, it was considered a very cost-effective way of curing and managing erectile dysfunction. So I think we're getting close to the end of our presentation, and we've blocked some time to answer any questions that come across. But here's a list of frequently asked questions that we get from patients. So just something maybe to glance over before the question and answer session. And certainly I'll be happy to answer any of those questions here in the group setting, or certainly in an appointment at the office, or if you send a message, I'll find a way to answer these questions for you. So yeah, I think again, this is my contact information here on this screen. So this is an area again that I'm very passionate about. I think we all specialize in different areas, particularly in urology. So just like I would refer patients with kidney cancer or bladder cancer to one of my partners who specializes in urologic oncology. I am a prosthetic urologist, and the major focus of my practice is prosthetic urology. And we tend to, generally think in our group that, patients will do better if they're working with a surgeon who's doing lots of a particular procedure. And this is an area that I enjoy and work on a lot. So again, I want to thank you all for attending this presentation this evening, and I hope you got something out of it and found it to be informative. And again, I'm more than happy to meet with patients, in person for consultation and discuss more specifics about any particular case.